Well, first of all, when you say the word callus, what you're talking about is thickened skin on the bottom of the feet. People commonly come in and say, I have a callus, it's painful, I have trouble, it feels like I'm walking on a pea or I'm walking on a pebble. The reality is it's one of several different conditions. A callus is generally a mechanical condition. It occurs on a metatarsal head or on a weight-bearing surface. There also can be called what's called a porokeratosis. A porokeratosis is a sweat gland that gets plugged. People think, my bottom of my feet don't sweat. How does that happen? But surprisingly, we do have sweat glands in the bottom of our feet, and because of friction, they can plug up and form a callus-type tissue. And then the other common problem is what's called a wart or a plantar's wart. A plantar's wart is a virus. People often get them on their hands, they get them on their knees, but probably most common is the bottom of their foot because it's furthest from circulation, being a virus. The difference in a plantar wart versus another area of the body is because of weight bearing, the wart gets pushed into the skin. So you'll go to the pharmacy, you'll choose an item to treat a wart. Well, the problem is you're only treating the skin that's formed over top the virus because it's been pushed deeper into the tissue, and that's why commonly for a plantar's wart, an over-the-counter medication will not be successful in treating the condition. What we do is we evaluate what is the problem. Is it a callus? Is it a plugged sweat gland? Is it a wart? And then from that point, appropriate treatment. Often it's a trimming technique. There's medication that can destroy a plantar wart. There is looking at why the callus may have developed. Is it on a bone surface? Can we use a custom insert to diffuse the weight? There is numerous different ways to treat, but until you understand what you have, hard to know. People will often have thick skin on the bottom of their feet. This is different than having a deep callus or some form of a lesion that's into the tissue of the foot. For that, if it's on the surface, I think it's fine. You can use an emery board, pumice stone, go to a pedicure, and let them sand the bottom of your foot even though it might tickle. When you are treating it yourself and it seems to be resolved, I have no problem with that. When the callus seems to be deeper, or when it's becoming more discomforting or it's not being resolved by these home methods that I described, I would recommend seeing a podiatrist.